This is Gwen Carden here once again with Rehana Webster, who is one of 29 EFT masters. Is that right, Rehana?
You're correct, Gwen.
And you've mentioned Gary Craig, who I don't know if a lot of people know, but he was the founder of EFT. You mentioned him in a former video. Is that correct?
Yes, that's right. He's the one who put this particular tapping protocol together and shortened it, made it much easier for anybody to learn and to carry away and be able to use very effectively.
So he wasn't the inventor of it. I guess it had been around a long time, and he just came and made it so that it could be more applicable to everybody?
Yes, it had been around in different forms, but Gary, in his genius, actually shortened it and made it so portable and easy to use.
Great. Well, now, we said in one of our earlier videos, not we, you did, that EFT is useful in all kinds of addictions. You said that certain addictions are easier, like nail biting and gambling, and other ones are more complicated, such as prescription drug abuse. And I know you've seen so many people and helped so many people. I wonder if you would like to talk a little bit about your experience with, say, one of the easier addictions that you helped to cure and maybe one of the more complicated ones.
Sure, Gwen. In my experience, of course, I'm just speaking from my experience, there are some addictions that are easier to get over. These ones are the ones, for instance, like gambling. Addiction to gambling where a person is at the poker machines, morning, noon, and night. That's an easier one for me to have worked with rather than, for instance, an addiction to a substance where the addiction is physical as well, physiological. That's the difference, So that could take a longer time, the physical addiction, because it's a twofold addiction. It's a mental addiction plus it's a physical addiction. Whereas a gambling addiction is a little different because there's no substance going into the body for the body to be addicted to as well.
So it's like one phase of pattern interruption, maybe not two, or behavior interruption of behavior. So one is when you add the physical addiction part to the emotional or psychic addiction to it, then that's double trouble, I guess.
That's exactly right. So it just takes a bit longer. It's more complex than simple addiction with gambling, let's say.
Can you give me a case example of a person with a gambling addiction that you worked with?
Yes, I certainly can. And again, this was through the prison system. This person had a gambling addiction, and they had racked up all kinds of debts and done some other things, so that got them into prison. And one of the reasons why, or the main reason why they had this addiction to gambling was to get away from the negative feelings. And the negative feelings were about the fact that this young woman had become pregnant, and it was a shameful thing in those days. We're talking 40 years ago. And in order to get away from the feelings of shame and rejection, she started to gamble and going to the casino and so forth. So it would take her away from her anxiety. And the more she gambled, the better she felt. Except when she came home, her feelings about herself were still there. So what we did was work on her core imprint, which was to do with her legitimate pregnancy and the shame that she felt she had brought to the family and the way the family treated her. And once we had worked with that core event, she no longer felt that shame and carried it with her, so she was able to not have to go to the casino to get away from herself.
Wow, wow. Now, what about a more complex addiction? How do you do that, even to get the person off of the physical part? I would think you couldn't even get to the core issue until they've worked through the physical withdrawal.
You're right, absolutely. So it's a two-pronged approach. You work with the symptoms, which are the physical withdrawal, plus you work with the core incidents as well. So you're doing a two-pronged approach, and with the physical symptoms, the person has to be quite committed to do the tapping, because as soon as the feelings arise, the person needs to do the tapping, whether they're with the therapist or the practitioner or they're not. So I usually set up a lot of homework for these kinds of addictions so that the person can be tapping away each time the feeling arises in their body that they need to have a particular substance that they're addicted to. So tapping away the desire for that substance. So it takes a lot of work. It's not, a 1-minute wonder necessarily. However, it does work.
So if they are going through some serious withdrawal, which of course you can do with substances, and you see it on TV shows where they're filming people who, let's say, are withdrawing from alcohol. I mean, this is pretty serious. Can they alleviate or at least reduce the physical discomfort while they're going through this if they're doing a tapping routine?
In my experience, they can. However, they have to be willing and able to do the tapping right on the spot. A lot of people, I think, forget to do the tapping, and then they're right into the feelings of withdrawal. So it's, catching the symptoms right before they flare up, and doing the tapping before on the symptoms that might flare up, and doing the tapping during the time that the symptoms are flaring up, and doing the tapping after the symptoms have flared up. So trying to alleviate in a time continuum, past, present, future, the symptomology, so that it'll just help reprogram the body and the brain.
Wow, well, this is fascinating. Well, Rehana, thank you very, very much. Again, you have enlightened me a good bit about this, and I'm sure all the people watching as well. We would like to encourage all of you to return to the website on a regular basis. We have lots of updates, timely information. We'll be posting this video as well as other videos of Rehana. If you enjoyed this video, we would like for you to click the like button on the bottom left side of your screen. Come back and see us often, and we will see you next time. Bye, Rehana, and thank you again.
Bye, Gwen. Thank you.